Hello, everyone, and welcome to the second session of the Wellbeing series, this time on reimagining mental health as a driver for impact. We are very happy to have you all here and especially to have an amazing panel. We are packed today. We have four speakers. We are going to start with Matilde, Mario, Daisy, and Pooja. Matilde is a licensed mental health clinician with over a decade of experience specializing in trauma-informed care and emotional well-being. She is committed to democratizing mental health access across Latin America, and she works for Glasswing International. Together with Mario Chavez, they work together in spread hearing trauma-informed care initiatives, and he is the co-developer of SanaMente, which we will have the opportunity to learn more today. Meanwhile, we do have Daisy, the co-founder and executive director of BRIO, advancing global mental health and well-being through locally rooted collaborative designing and training initiatives. And as an amazing case study, we'll have Pooja, the co-founder of Kashmetalaya Foundation, dedicated to building a compassionate and resilient society through social, emotional, and physical learning. So without further ado, we did lose a little of time trying to start the meeting. So thank you. Thank you and sorry for the timing. Without further ado, I will pass the word to Matilde.
Hi, everyone. It's so nice to be here today. Um, and I'm so honored to be part of this panel. Like Cindy said, I'm a licensed mental health clinician, and I have over a decade of experience working in trauma and mental health, specifically throughout the Latin American region. I work with Glasswing International. Right now, in my role in Glasswing International, I specialize in special projects and initiatives, and I work closely with Mario, my colleague who's here today as well, in growing SanaMente, our flagship mental health program, which we will learn more about. So SanaMente is our flagship mental health program, and in order to, before we go on to talk about SanaMente, I wanted to talk about what I'll give you all a little bit of more context on um, on why we developed the program to begin with. Latin America is still one of the most violent regions in the world. Here are a few statistics to paint that picture. In 2023 alone, there were over 100,000 murders were reported, and this is a very alarming figure that reflects more than just crime statistics, but it reflects a region in crisis and a region in trauma. This widespread violence goes beyond physical safety. We believe it leaves deep psychological wounds in individuals and in families and in entire communities. And those wounds can spread psychologically because individuals are not just living in fear of what might happen outside their homes, but they're carrying that fear with them every day at school, at work, and outside their homes. And we have seen the effects in rising levels of anxiety, in sleeplessness, and even in physical health problems. And these aren't isolated symptoms, they're a cumulative toll of this relentless exposure to stress and trauma and instability in the region. Um, and we see that these high risk environments, they slowly chip away at an individual's and communities' well-being, where mental health needs go unaddressed, the cycle of violence only deepens. And that's why we must recognize this not just as a security issue, but as a public health crisis. And we see that mental health support must be part of the solution and not just an afterthought at Glasswing. So in Sanamente, and just to continue with a little bit more context of our program, in El Salvador, Guatemala, and Honduras, thousands of educators, healthcare workers, and law enforcement officers, they wake up every day to facing severe communities in severe adversity. And they're on the front lines, and not just on the front lines of education, health, and safety, but also on the front lines of trauma. Um, and at Glasswing, we believe in order to heal communities, we must also care for those who care for others. So healing the healers is really at the core and at the heart of the SanaMente program. It supports over 100,000 frontline workers across the region, and we provide them with tools to understand and manage the effects of stress and trauma. Um, on themselves and on the people that they serve. So, in order to better recognize it in others, we first help them recognize it in themselves. And we do this through practical strategies for emotional regulation and resilience. We're helping them reclaim their own well-being, and we're helping them gain that locus of control um, of within their own well-being. However, the impact doesn't stop there. These individuals, we believe, are becoming agents of change because by caring for their own mental health, they are better able to foster healing and promote this healing and create this ripple effect of hope in healing in their schools, in their clinics, and in their neighborhoods. Um, and we believe that when we invest in the mental health care of these frontline workers, we don't just strengthen the individuals, but we transform entire communities because it does create this ripple effect of care. And from here, I will pass it along to my colleague Mario to discuss more on the theory of change of SanaMente.
Thank you, Maddie. Well, good morning, everyone. And well, thank you, Catalyst, now for this opportunity to share part of our work. And well, as Maddie already, she gave you a picture, the context where we come from, where do we start with this program? I just want to briefly mention what's our theory of change before I go into give you some insights of what we have found throughout this program. So what's the theory of change for SanaMente? Well, we start by saying that if we generate trauma-informed care ecosystems, for us, an ecosystem is compounded by schools, hospitals, police stations. So we generate that trauma-informed care in these ecosystems, and we democratize access to mental health in communities in the Northern Triangle affected by violence through the dissemination of psychoeducation programs on stress, trauma, self-care, and mental health support, we will reduce the negative effects of trauma in the intervened communities, which ultimately will lead to the reduction of violence in those communities. So that's our baseline, that's our theory of change. So I would like to, before I start providing you with some insights, I would like to begin with a simple invitation. Try to imagine yourself being a nurse, a teacher, or a police officer, someone who shows up every day to take care of others, but constantly faces trauma at work while also worrying about your own family's safety at home. That's the daily reality for many, many frontliners across Latin America. And let's remember that these individuals are pillars of their communities. When they are emotionally overwhelmed or unsupported, the services they provide, education, citizen security, or healthcare through in the communities they hold together, everything could start suffering. So today, I would like to invite us to explore one very important question. How can mental health practices reduce violence and foster peace, not just for individuals, but also for the entire community? So I would like to share with you 4 key insights from our mental health program, SanaMente. And it's important to mention that all this information comes from our monitoring and evaluation system, which allow us to track progress and understand the effects and improve over time. So we have hard data, but we also have testimonials from people who has participated in our program. So if we move forward, I would like to share with you one of our first insights. As we've seen for many SanaMente participants, trauma and stress are invisible burdens. When people live under constant stress, they often stop noticing how it affects them. So our surveys has shown that before taking part in SanaMente, only 49% of participants recognized how stress showed up in their bodies or in their emotions. However, after taking part in SanaMente, that number jumped to 95%. So this shift in awareness not only transforms the individual's experience, but also creates a ripple effect in improving the emotional health of families, workplaces, and the entire communities. Not only that, we also found that 96% of the participants began using simple but practical tools like breathing exercises and mindfulness in moment of tension. So that pause, that awareness is not just self-care. At the end of the day, that could represent violence prevention. So my first takeaway from this is that when individuals learn to recognize and manage their stress, they reduce their risk of reacting aggressively. You know? And this improves not only their well-being, but that also contributes to more calmer and more stable, in calmer workplaces, but also could contribute to more stable homes. So that's our first insight. If we move over to the second insight, if we can go to the next slide, please. Yeah, thank you. One of the most transformative effects that we have seen is that trauma-informed care could lead to empathy, to better, to have that sense of empathy, both in oneself, but for others. For example, we've seen how teachers and healthcare workers began to listen more deeply, to be more emotionally available to their students or their patients. As one teacher from Guatemala said, and I quote, "SanaMente has helped me to listen to my students a bit more, to have that availability of time, because sometimes with our own tasks, we limit ourselves a bit. I believe that the program also raises our awareness about our role, that we need to help and support the young people who have certain traumas or problems in their lives." That's a really strong statement. And we've seen that this sense of community has grown. The number of participants who felt integrated into their communities went from 7.3% to 44.5%. So this change in perspective helps create stronger community ties as participants feel more connected and supported of each other. So our second takeaway is that empathy can create stronger social bonds. And these bonds can create safety nets and more resilient communities, which are essential for reducing violence and healing from trauma. If we move forward to the third insight, we've seen that many of us know how workplaces can have an important effect on our mental health, but in high pressure fields like citizen security, healthcare, or education, that stress can lead to a tense working environment. So trauma-informed care training has an important effect on the workplace dynamic. After taking part in SanaMente, we think that 95% of participants reported a better workplace environment. They know it is stronger teamwork, more emotional understanding, and greater mutual support. For example, one healthcare worker from El Salvador shared how a group of co-workers and colleagues came together to help another. And I'll start the quote. "A colleague was indifferent to work. I talked to her. She had a major situation regarding her child's health. We asked for psychological help and we got it. We saw her overwhelmed by her child and in a difficult financial situation. So we organized a fundraiser, put ourselves into her shoes, and in other situations, we supported each other to feel the burden lighter." That message is really important because it captures how we want to transform this workplace environment. So our third takeaway is that when the workplace becomes empathetic and emotionally safe, people support each other instead of clashing. This leads to better mental health and better service delivery, creating peaceful environments that prevent stress from turning into violence. And our fourth insight from our experience through SanaMente, if we can move to the next slide, please. Thank you. One of the most lasting change we've seen that the most lasting change happens when institutions adopt trauma-informed care as a system. That means what we call entire ecosystem. Schools, hospitals, and police departments, when they are trained to recognize and respond to trauma with empathy instead of punishment. So when the entire institutions embrace trauma-informed care, the effect or the impact is multiplied. So we think that by integrating trauma-informed approaches into public institutions, communities become more empathetic and resilient. One police officer from Guatemala captured this in a better way than I do. He said, and I quote, "It, talking about the training, helped me a lot to be tolerant, especially to understand that my mood doesn't have to affect the other person. If I'm very upset, I still have to attend in the best way. It really helped me with how to manage myself. I learned that no one is to blame for my mood." So we've seen that when people throughout a system develop this awareness, they model it to others, either staff, students, or patients. And when that happens, it can change how the entire institutions work. So the fourth takeaway that we get from this is that trauma-informed ecosystems can create safer and more resilient institutions. They shift social norms around conflict, regulation, and care. And at the end of the day, this helps reduce the cycles of violence. So, in conclusion, what can we get from all that I had shared with you? Starting with what Maddie mentioned at the beginning, this context that we've seen and that helped, create this program that we have, is that the chronic violence creates chronic trauma. And if that is left unaddressed, that trauma can lead to more violence, either at home, at school, or at work. But we can break that cycle. We've seen how trauma-informed mental health practices like emotional regulation, empathy, or stress awareness can make a difference in the lives of individuals. But the real power of these tools is not just about helping people feel better. It's how they can change the way people interact with others, either at home, at work, or across institutions. So SanaMente results in our experience shows that when people can pause, regulate, and respond with empathy rather than reactivity, something bigger starts to shift. Conflict decreases and trust begins to grow. So when that happens across communities, schools, clinics, or even police stations, we start seeing what a peace building pathway can look like in practice. Not as a distant ideal, but as something that we build step by step or interaction by interaction. So I would like to close my presentation with a final message. Healing trauma at the individual and institutional level can transform entire institutions. So thank you very much for this opportunity, and I'll stop right here.
Thank you so much, Matilde and Mario. It was a great first part. And as I have mentioned in the chat, please feel free to add any questions, and as we will later pass to the Q&A session. But for now, I will pass it to Daisy and later to the case study from Pooja. So Daisy, up to you.
Hi, everyone, and thank you so much, Maddie and Mario, for that amazing presentation. I'm always so impressed with what you all do, especially with frontline workers. So welcome, everyone. Again, thanks for being here with us. I'm the co-founder and executive director of BRIO, and we work with local civil society organizations who want to integrate mental health into the work that they do in communities and eventually into the systems where they work. And so to talk about that a bit more concretely today, we're going to be sharing about integrating mental health into an education system in India. I have my partner here, Pooja, who will be sharing more about specifically what that process has looked like. But first, I'd love to talk about why mental health and education are important and how mental health can actually drive some of the outcomes and promises that we put on education. So let's go to the next slide, please. All right. So when we think about education and its role in society, quickly we can realize that there's a lot that we expect education to deliver, right? It's taking care of our kids during the day. It's forming them into citizens, into future workers, into future leaders. And it's preparing for what is coming for all of humanity. It is preparing the next generation to be able to lead and create and to build the kind of world that we want to see. That is a huge task. And the reality is, as many of us know, that around the world, education faces immense systemic challenges. We know that in many cases, public education in particular is underfunded. There are crowded classrooms all over the world. There are children who go to school and are not learning. We know that since COVID, education outcomes have really suffered in many, many countries. And so the fact of the matter is that this is a tough and complex system, and it's asked to deliver a lot for us. And the truth is that, in some places around the world, people who can afford it choose to send their kids to private schools, right? Instead of, participating in this public service, they've gone private. But also the reality is that public systems, whether it's healthcare, education, public safety, et cetera, we rely on these to serve all of us as citizens, and particularly in marginalized communities. So in the state of Rajasthan in India, for instance, there are 3.3 million children in the primary schools, so grades 1 through 5 alone. And those are the schools that serve them. And also, we know that all of the people who are involved in this education system face many burdens. In communities where life is really difficult, children will walk into the classroom knowing that a family member might be suffering, or they might be experiencing food insecurity. Effects of climate have also impacted their overall health and well-being. There are also persistent gender norms, which I'll talk about in a moment. And so children are carrying these burdens as they walk into the classroom. Teachers also live and work in these communities and face those very same environments that can be quite difficult, especially in rural areas. And finally, school leaders and education officials. So we're talking about principals all the way to district leaders to bureaucrats who work in the education apparatus, all face this pressure of trying to deliver on education's promise. And so what we were attempting to do with Kushishela, which I'll talk about in greater detail now, is to, one, integrate mental health into education in terms of what children actually learn and how they learn in the classroom to strengthen their ability to engage in school. But also to support teachers in this really challenging role that they have in a meaningful way, and more than just teaching them how to help kids, but also helping them to support themselves and sustain this work. And finally, to also integrate mental health into the way that the bureaucratic system operates. So I'll talk about each of those levels now. All right, so let's start with the students. This might be the most sort of obvious need for mental health, but mental health can have impact on how students engage in their everyday life. Because we know that learning starts with the ability to actually focus, connect, and stay curious, even when there are challenges all around us, even when life is difficult. Mental health allows us to not be completely overcome or controlled by those difficult experiences. And also not to say those don't exist, right? To be able to exist with those. In our pre-pilot evaluation, however, and we've measured mental health as sort of a behavioral self-efficacy measure because that's an easier way for children at this age to do so. We found that 60% of the children actually reported difficulty in self-efficacy, so taking action on some core life skills. Girls especially started with a pretty low baseline, and that is partly, we think, attributable to some of the persistent gender norms that they face. And so in order to support all children in their ability to continue to show up and be curious and be active in their own learning, we really need to build out those underlying mental health processes so that they can become aware of their inner experiences and choose how they want to respond. And so some of the skills that we teach the kids start with very simple, physical sensations and understanding what's happening in their bodies, eventually in their minds and their emotions. And not just being able to name them, but also being able to say, amidst all of these experiences I'm having, I have a sense of what is important to me. And so when children build these skills, as they did during this program, they speak up more, they express themselves, they ask questions, they raise their hand in the classroom, and they actually started attending school more frequently. And you see some data here, but more than half the kids improved on this very measure that we started out with, and 69% of the girls improved meaningfully, which is really exciting. Teachers also observed that kids came to school more frequently because of the way that the classroom environment is changing as a result of being able to integrate these practices. All right, let's go to the next slide, please. And so, Maddie and Mario also talked about teachers. This is a difficult job, right? We all know this. No matter where a teacher is teaching, there's a lot of pressure, not only to deliver the actual content that they're being asked to deliver to children, but to do it creatively, compellingly, compassionately, and in the midst of living real lives as adults with their own families in the community. And so a teacher's ability to really show up and experience well-being in the midst of all of this is pretty tough when a lot of times teachers don't have a lot of systemic support. By the numbers, there's 74,000 primary schools in Rajasthan, and many of them are staffed by only 1 to 3 teachers. And so imagine not showing up to work and knowing that the kids are going to school and no one is going to be there. And so teachers being able to show up consistently and to offer themselves to students every day is really critical and also a huge challenge that the system faces. And so back in 2020, we started supporting teachers with a well-being program designed specifically for them called Hausla. Over 124,000 teachers have experienced it now, and 70% of them improved meaningfully on a well-being index that's recognized by the WHO. And the important thing about this is that the experiential learning that they received, rather than just didactic teaching of like, here's all this information, internalize it, apply it, they were able to take that experience back to the classroom in order to create a compassionate environment for their students as well. And so it is so important for teachers to show, to experience positive mental health, to be able to navigate their experiences with greater agency and openness so that they can offer patience and resilience to their children every day. And you can see in the small picture here, a couple of teachers who were trained on Kushishela. That book they're showing, they actually made that themselves. We didn't tell them to do that. That was something that they went above and beyond and created because they thought it would be cool. And so it shows also just how when teachers feel inspired, that internal intrinsic motivation really makes a huge difference. Next slide. All right. So the final piece of this is that, a lot of times when we as nonprofits and social entrepreneurs, innovators, want to work in systems, it's challenging to take the work to the level of the system itself, right? Sometimes, you kind of stay at the delivery level where, you've got the permission to go and work in a sort of public sector institution where it's, care is being delivered or some kind of program is being offered. But it can be hard to make that step to transition to think about how do we actually work with the people within the systems, help them think about the processes and the creativity of that system, and leverage mental health to strengthen that as well. So we'll talk about this a little bit more with Pooja when she and I have a conversation in a few minutes. But the reality is that, sometimes many of us think of people in bureaucracies as a certain type, we kind of have like a bias against them. And this is very common across various regions around the world, right? We might think of corruption, we might think of laziness, we might think of someone who just shows up to work to check a box. But the truth is that there are so many mission-driven systems leaders out there who took this job because they really believe in the possibility of this system to deliver on its promise. And we've worked with many of them in the education system. So despite all of these challenges that are very real to them that they face every day, they actually do believe that education can deliver a better future for children. And so supporting them and their mental health allows them to show up to that role with greater creativity and commitment, even though there's so many challenges and constraints that they face, including, applying for a budget from the state and not getting it, or having their colleagues transferred out of their department suddenly, somebody that they worked with for a long time, right? These people don't necessarily have a ton of control over their working environment. But when we also ran HOSLA with a number of officials, we saw that they specifically improved in the targeted skill of psychological flexibility. And so they felt that it was important for them to ensure that this actually rippled into the system, that teachers were learning it, that children were learning it. And so it is possible when you're working with officials at all levels, right? From a state level leadership all the way down to local leadership, it all matters. That they're able to actually internalize some of this mental health and use those skills to show up to this role and make the impact that they came to the system to make. And you'll see the quote here that I'll call out, and then we'll move on. A woman who co-created Kushishala with us, who was part of the Rajasthan state government, said that this work really sustained her through a very difficult health diagnosis. And she showed up during a teacher training just to say that. And so I do believe that there are truly motivated, committed individuals. And when we can work together with them, that's when the real change happens.
Thank you so much, Daisy. It was amazing. Now, as Daisy also gave a little spoiler, we will pass to Pooja, as I mentioned, is the co-founder of Kshavilataya Foundation, and also it's a really important part of BRIO, which leads initiatives to strengthen mental health and well-being in education across Rajasthan and Bihar, focusing mostly on equity and resilience for both students and educators. So, Pooja, up to you now.
I think Daisy is going to ask the question and then I'll respond to it. But thank you for inviting me here. Means a lot.
All right, so let's go to the first slide, please. All right, so Pooja, well, first of all, for everyone here, you might be wondering, okay, so there's a lot of people talking about working with public systems to integrate mental health. And when we first started this, I had a lot of questions about, okay, but how do you actually do this, right? It's easier to say than to do. And what does it look like in terms of this whole engagement with government? How do you even begin? And so Pooja, I was wondering if you could tell us a little bit more about how HOSLA was created and how it actually helped you all step into a role of working with the government on well-being and mental health.
Thank you, Daisy. So as Daisy mentioned, this program was created during COVID in 2020. And in India back then, the prime focus was to make sure how students learn digitally. So the environment that we are talking in India is like village setup. People don't know how to use internet, how to use gadget. But because of COVID, the prime focus was that how could teacher facilitate these through worksheets? So they were creating WhatsApp groups, they were sending worksheets. The prime focus was to focus on foundational literacy, numeracy, because there is this backlog, students are missing the classrooms. But nobody was talking about teacher well-being. And the places that we work in, the teachers were supposed to run the quarantine center. So all the people who used to come back to villages, the teachers were supposed to make school as a quarantine center, and they had to quarantine their people so that the village doesn't get infected. They were also doing a lot of ration distribution because people over here needed it. So teachers in India are like when government has to do extra things, they will use teachers to do those extra things. And that time, we were really struggling with this question that, okay, nobody's thinking about teachers, nobody's giving care to the caregivers. And that's how we landed up with this program called as Hosla, which is a truly celebrated program, because in my capacities of engaging with teachers directly, I remember most of them have said that, this is the first time in my 25 years of service, 30 years of service, 10 years of service, that someone is talking about me, my emotions, my feelings, because generally the trainings that teachers experience is related to pedagogies, how you teach math well or language well or classroom management, but nobody actually ask them how they have been feeling and they've been doing. So irrespective of whether COVID or not, this program still holds the value, because we e- educators have said that, it's like someone has studied my mind and, peeped into my mind and created this program for me. Like someone has done a very deep study about me. So that's how we created with BRIO. And it's a very short, I mean, teachers already are burdened. They don't have time to do long programs. So how do you give the taste of well-being? So it's a very well thought program where you just give taste of well-being so that people grasp it and they're able to, not making it challenging for them. So they have list of things to do. And again, you've introduced mental well-being. So that's how we created it.
Yeah, and my understanding is that it was kind of a grassroots start in terms of your understanding of teachers' reality, as you described, teachers experiencing this, saying this is fantastic. And then this was something that the system needed, right? So the system, the government officials who were hearing from these teachers understood, like, oh, this actually helps us, right? And so for those of you who want to design with government, this is a key question that we have here on the screen. What can we do to actually help this system serve people better? And when we reorient the work around that perspective, it's more likely to create that opening to collaborate with the government. So next slide, please. So the next thing that happened was that the government invited you all to co-create something for children. And so I'm wondering if you could say just very briefly what that process looked like, and how did you actually co-create something with the government?
Yeah, so government is already struggling with a lot of things. There is new education policy. They don't know how to implement it. They don't know how does it look like in action. And I think when you, as Daisy was mentioning, when you understand their need, you understand their struggles, understand their challenges, and you are there to serve the purpose, not to, build a good project. Look, we have designed a good project and we know it's working. So here it's what we want to present it to you, but actually speaking into their challenges, understanding their needs. And when you go up with that openness that we are genuinely here to help you to figure out this implementation, they're happy to collaborate. So that was the first thing, like, in very briefly, understand what they need and offer it with openness and not with your organization's agenda or, the best project that you have. And secondly, how did the process go? System works in a very different way. There are multiple things, there are multiple order letters which is happening. I think one of the key things that as a team who is looking to collaborate with the government is like keeping up the resilience, keeping up, taking not taking anything personally. So there are times when they will snap, there are times when they would not know what to do. You can't expect them to have a 10-year vision, 5-year vision. It's like you have to practice those skills of well-being within your team. If you're talking about resilience for your students, for your educators in the team, while collaborating with the government, you need to practice resilience. There have been times where they've disregarded our ideas, but again, we have gone back to him because there is this genuine purpose of supporting to the well-being. So I think understanding that the skills that we want to offer for others, we have to practice within team, and again going back to the system again and again, because they don't remember anything. They have a very short memory. They have multiple things to do. So you have to keep coming back, keep following up, and I think that is what has helped us to sustain this partnership and taking it to this level where we are going to scale it for the entire state. So
Yeah.
I hope I've answered, Daisy.
Yeah, that's right. And I think part of what you have to thread the needle on is like, centering the government, empathizing, connecting with them as human beings, and continuing to offer value, but also being really dogged and persistent, in a system where, like I mentioned, there are so many people who are mission driven in the system. We're not saying 100% of the people are very mission driven and committed, right? And so, being savvy and smart about how you build those relationships, when do you push and when do you yield. I mean, these are skill sets that benefit NGOs and social innovators who want to work with government, especially to build that long-term relationship. And sometimes it's one step forward, two steps back, right? And so being able to be a part of this journey of co-creating and collaborating with the government is quite challenging, but it is really the only way that we can sustain some of this work at scale, particularly for populations and communities that are marginalized. Okay, so last slide, please. All right, so I mentioned that we had piloted Kushishala. That was in collaboration with the Rajasthan state government, and it was run with over 1,300 kids. And so now, this is an unfolding story, right? So Rajasthan has decided that it wants to integrate Kushishala across all of the schools in the state. So tell us, Pooja, a little bit about, how you see like the engagement and the relationship with government for the next few years. And what would you like to happen as a next step to support the government in doing this goal that it has now set?
Thank you, Daisy. I'm emotional while I'm hearing this question as well. So we are not a big NGO. We are not a brand, but for us, the journey was just the purpose of showing up with quality. They are big NGOs. They're people who they're like government has a lot of collaboration. There are a lot of people with a lot of money, lot of resources, lot of ideas. I think what they could understand and see in us was the quality and the passion with which we delivered the content. I remember 4 years back when we were writing this textbook, we thought that this is it. Like we have to just give the handbook to the state and our project is over. But it surprised us to see that the state wanted us to do the pilot and state invested the money. So getting money from the government is very, very difficult, but they were so open because they believed in this idea and they invested the money to do the pilot. And we did the pilot. And when the picture that you see is the head of the institution with which we work directly, and they're sitting with children. They visited the classroom. For them to visit the field is also a very big thing. They visited the classroom. They saw the impact of the of Kushishala, where they're seeing students responding, expressing. They also did this treatment and control. So they went to a Kushishala classroom. They went to a non-Kushishala classroom. They could see the change, and they said, look, we're going to do this for the entire state. And I think it's like a dream come true. I have not been to a classroom where teacher is asking me about emotion, and this is the government school that we are talking about, where we will be implementing this. The best part, and we're still struggling. I would be very honest. We're still struggling to get this resource from the government, where they say that okay, the budget has gone to the. We all know the academic section, this seems important, assessment seems important, mathematics seems important. So the huge number of budget is diverted to that part. But I think today only the director said to the person who's responsible for training, this is important and we want to do this. So I think for a head to say that well-being is important and we want to do this and this is your KRA, you have to manage it and you have to get the resource, is something that I'm visualizing. And to respond to Daisy's question, the state usually struggles at implementing quality at scale. So what BRIO and Shamtali are doing together is how can we find out those nuts and bolts where we can leverage it, we can find those processes which we can do it at scale also, but with the quality. The quality is not compromised. So what are few don'ts that we are that's non-negotiable. So they will ask you to do an online training on a YouTube live, and an entire teacher is trained. So no, that's a non-negotiable. We'll figure out an innovative way to train at scale. So these are few decision making that both Shamtale and BRIO are doing together and supporting government to think in a different ways of how quality can look like at scale. So I think that is what I visualize, Daisy, for the coming years. Thank you.
Thank you, Pooja. It is so important to recognize also, especially for any of you all who are working to integrate mental health into a system, or you're considering scale, it just thinking about what are those non-negotiables for you, right? We know that with 3.3 million children, or even hundreds of thousands of people, it's much harder to have control and visibility into what they are actually receiving. That's just a reality. But what can we do to raise the bar on the quality and the integrity of this work, right? It's too easy to say, oh, we're just doing this with 1 million people. It's much harder to say, we stand behind this, right? What these people are experiencing is important to us. And not just, in name and being, bragging rights, or, whatever else. Like, those are not the motivation for this. The motivation is deep change. One of the things that Rakesh Rajani, who writes about systems change with government, and for those of you who are interested in that, I've just pasted a recent article he co-wrote in the chat here. One of the things that he said is that we are not short of good ideas, right? We have lots of great innovation. There's an endless number, but the number of organizations and individuals who are able to actually partner with government and have the understanding required to help government implement this and build it into the system so that the system can change, that's where the rub is. And so that's why we thought it was really important to talk about this part of it. The integration piece, I think, you can see from the evidence and the proof of, all of these amazing initiatives that this really matters. And so how do you get it into institutions in a meaningful way? And so I'm seeing contacts being shared here, so please feel free to reach out if this is something that you're doing, because it's something we're passionate about too. And so thank you so much, Pooja.
Thank you.
Thank you so much. That was amazing. So yeah, let's pass to the Q&A section, as we do have some questions in the chat. And I am going to start with the one asked by Ankita. She says, some people find strict deadlines or disciplined routines to be rigid and mentally taxing, while too much flexibility can lead to delays or lack of accountability. From a mental health point of view, how can we create a work environment that feels mentally light and supportive while still encouraging timely submissions and a sense of responsibility? So I think this is related to each one of your works. So let's start with Mario, and then we can get a short insight from anyone.
Sure, thank you. I think that, stress is something that we have to face almost every day. It's part of our daily basis. So I guess part of what we are trying to do as SanaMente is trying to provide strategies, tools, how we can manage that stress. Because at the end of the day, stress is always going to be there. It's always going to be a burden, but how you manage that and how you respond to that, that's the way we can, transform it, and that's the way where we can have positive outputs. It's not so much about, we're still going to have like a lot of responsibilities, a lot of things that we need to achieve, in either aspect of our lives, of our daily basis, either if you're a teacher, a healthcare worker, an officer, you have a lot of responsibilities and deadlines to meet, and, a lot of commitments. But how you organize yourself, how you deal with that, I think that's the key on how we can take care of our mental health and how we can provide better services. So that would be my answer.
Thank you. Daisy, what about you?
Yeah, I completely agree with that. Giving people some of those inner tools is so important. A framework that we like here that we've used with Shamtalia together as a team, and also with some of the participants that we've worked with, is called the COMBI model. So I'm just going to put that here. You can look it up. But it talks about how in order to have behavior change, you need three sort of big components. One is the capability, the opportunity, and the motivation, right? And so when we think about how do you help someone do something that is difficult for them? Do they know how to do it? Do they have some of those inner skills? Do they have the actual technical skills, for instance? Is there a chance for them to do that? Is there an invitation or a requirement? And then finally, like, how do you motivate people to do things? And sometimes organizationally, folks think of motivation as just external incentives, like punishments and rewards, which do exist across many different kinds of structures. But we also think about intrinsic motivation, like what makes them inspired to do something.
Thank you. Pooja, what about you? We heard some great insights from you, so I'm sure you have more to say about this topic.
I think I personally, the question that she asked is finding a balance between, holding people accountable for the responsibility as well as, taking care of their mental health. I think uh, uh, I don't see them as two different things, because if you have structure, if you have processes, if you have system, that gives you more agency. It doesn't sound very obvious because we have somehow understood structure as something which unrestricts, like it's not giving me freedom. So in an organization, I guess if you're talking about an organization, Ankita, you have to look at how your values are stitched to the processes and structures that, as Daisy was mentioning, about the capability, about the opportunities that help them practice. Because if they start practicing that, holding them accountable, holding them responsible becomes easier, because nobody at the end of the day wants to get up and say that, I want to perform bad at work, or, I want to get scolded by my boss. Everyone wants to do at the end of the day good work. So I think that can be done through processes and systems in an organization.
Yes. Thank you so much, Matilde. You are on mute.
Apologies about that. So I think that this is a really great question. And one approach that we have found particularly helpful at Glasswing is co-creating expectations with teams. When deadlines are set collaboratively rather than imposed top-down, individuals feel more ownership and less pressure, and it becomes a shared commitment and not just a task to complete. And then building those with, flexibility and clear boundaries. And I think that from leadership to staff-wide, another tool that we use at Glasswing is normalizing mental health check-ins, and normalizing mental health in the workplace, because that is what really creates that intrinsic motivation that some of my colleagues have mentioned. Something simple as asking, like, how is your bandwidth this week, or doing a quick check-in or status in meetings allows them to speak up early if they're overwhelmed, before it goes into burnout or delays in progress. And I think accountability can also be framed in a positive way, using like project management tools and supporting forward momentum, not so much policing the output of it, but supporting the momentum of the team, can hold the team members accountable in a way that is positive and motivating. And I think that, what's most important is that leadership models a healthy relationship of what the accountability and what meant setting these boundaries and normalizing mental health looks like.
Mm-hmm. Thank you so much. Now, the second question, it's from Beto. Beto, it's a notable member of our organization and actually moderated a similar session a while ago. So, Beto, if you want to ask your question, I see you're the only one with the camera on, so I think you're fine with it. If you want to go ahead and ask it.
Yeah, no, first of all, I'd like to thank everyone. It's really impressive, all the work that you guys been doing. I'm a very huge fan of Daisy, BRIO, and now learning more about Pooja's work and also Glasswing. So it's amazing all the efforts you guys put to raise mental health. So my question is related to building these intersectoral connections of mental health, reframing not just as a health issue, but more as a progress and development perspective, and how these could be leveraged, especially working with governments, and to set this prioritization of mental health in different agendas. So something that we are expecting to strengthen, we are calling the high impact mental health ecosystem. So pretty much what you guys mentioned resonates a little bit with this perspective. We'd love to hear some more about your visions on that.
Thank you, Beto. So anyone wants to answer? Or I have to pick? Okay, Daisy, go ahead.
I'm happy to jump in and everyone can build on this. Yeah, I think, when we talk about ecosystems, it's we know that it's so needed to have different connection points across a community's lived experience that care about the same thing, right? It can't be sort of just, there's a mental health, the way that it works right now is there's a mental health condition or something, and then, it kind of goes into this silo of treatment, maybe in a clinic or in a therapist office. And we want it to be more everywhere. We want everyone to participate. How do we do that? I think one of the things is, at least at a meta level, to think both as where do you want to be an ideologue, like an idealist, and when do you want to be a pragmatist? And so the idealist part of you is going to be thinking about, okay, so we're starting with mental health because this is an issue we care about, and we think it's important for everyone. And that's maybe the posture that we have and the values that we carry into this process. And so sort of define like, well, what do we want this to look like? What is the ideal state? The pragmatist part comes in thinking about, well, what do other people care about? They might not completely come on board with you into the idealism about mental health, right? They might think like, oh, that's really nice, Beto, but I care about this other thing over here, actually. And so finding the connection point in the system where there is that intersection is going to be so important. Pooja mentioned like thinking about, okay, what does the government care about? Like, what are they evaluated on, right? What are they, and even in, some of these contexts, what are they trying to do better than other states? And how can mental health be in service of that, right? And so it's about that practical evaluation of like, what does it take for this person to say, okay, this does align with my interests, my values, what I care about. And so as we build coalitions, it's easy to build coalitions with people who agree with you. And it's great to start there and have like, the colleagues and friends, but then eventually to reach out beyond folks that may never say mental health is their number one priority, but there is something about it that does promote their number one or number two priority. How can we connect with them and convince them to be part of that with us? So I'd start there.
Mario, do you want to go next?
Yeah, sure. I think that's a really important question, and what Daisy said is really, really important. And I think I just not to repeat, but maybe just to complement a bit. I think that one key insight, is that, if you want to build an integrated and multisectoral approach, that requires not only partnerships, but it requires a shared language, shared practices, shared responsibilities across sectors. For example, in SanaMente, we work with different sectors. We work with education, healthcare, law enforcement, and usually, these sectors often operate in silos. But what connects them is that they are, at the end of the day, the first point of contact when people are in crisis. So if we want to build like true mental health ecosystem, I think we need to focus on cross-sector training, providing trauma-informed care training to different sectors, but using a common framework, because that can help, speak in the same language and understand each other, share tools, and also, institutionally embedded, working with the ministries, the authorities, and leaderships to integrate that mental health practices into protocols, supervision, policies, that it's not about just training people. It's about, how we start to build change within the system. So I think that is a challenge, of course. It takes time, but if we do that, and if you're constant in that process, and if you co-create, and if you are, joined by these key sectors and key people, I think you can start seeing some changes. So that'll be my.
Yeah, thank you. And Matilde, what about you?
Well, I really will just echo on what everybody else is saying. I think what my response was going to be is what my colleague Mario just mentioned was that something that's really critical is to co-create with communities. We find that too often programs are designed far from the realities that they're meant to address. And a quote that I really love is those closest to the solution or those closest to the problem are closest to the solution. And when communities, especially those with lived experience, are involved, not just consulted, but truly partnered with, the result we feel is more culturally grounded and more sustainable.
Thank you. Now, Pooja, also on what Beto asked, but what was also been asked on the chat, I think there is also a question connected to your part that asks, what lessons have emerged about the role of psychological safety and flexibility and enabling innovation within bureaucratic systems? So I think it's more connected in your work with the government and how you deal with that.
Thankfully, the policies are talking about values and cultivating those values, especially in India. But the point is that they don't. So you, as human being, try to put words or try to put meaning, which is easier to decode. So for a long time, we struggled because they understood that life skill is similar to well-being, right? So I think the basic struggle here is everybody wants it, as Daisy mentioned, that everybody needs it, but they don't know what it is. Like they're not able to articulate it that, this is well-being that we are talking about. Everybody enjoys being safe. I mean, it's not just enjoys, it's like you need to be safe in order to share your thoughts and feelings. And whether it's a head of the institute in a CRT that we work with, or it's a minister who makes decision related to policy, but nobody knows the how. Thankfully in India we had this tradition in terms of religion, but again there is this generation who doesn't believe in God or all these traditions, so we've forgotten everything and we are just hanging around. And with digitalization, with teachers need to be present online, everything has become very, very complex, so nobody knows what they want. And when you present the vocabulary which they understand, which they are able to relate, there is more buy-in of it ultimately, because they know, oh, this is what you're talking about and this is how they can change themselves, because it's not just trauma informed, it's also resilience informed. They know that, okay, there is a problem, but I can solve my problem on my own, because you can't meet the problem at scale until unless you make people believe that they themselves can solve the problem. So I think finding that vocabulary in their local context, cultural context, how does it look like and how they can do it, solves a lot of problem at a system level, also at an individual level also, I guess.
Yeah, thank you so much. That was so helpful. And thank you to all the speakers for the amazing presentation and the Q&A section. I know that there might be a lot of questions or comments to say that we cannot answer everything right now due to time constraints, but please feel free to contact us or to reach out to the speakers directly in case you have any other doubt or thing that you want to add. So quickly, I will launch the learning series feedback. Please make sure to answer and help us improve our next sessions and tell us what you liked and not. Komi, next, please. So basically, we are just presenting the upcoming events. We do have a fundraising masterclass in Portuguese, which is going to be the first one, which is not in an English language. There are going to be 2 parts in the end of June and the beginning of July. You can find all the information in the chat as always, so join Ana Flavia for a great session and amazing resources. Secondly, we do have on September 4th, another session coming up, which is going to be a book launch from Emily Cressiel on deep listening. So it's kind of on the same situation of well-being. And except of a book, we will have a series as mentioned, so you can find the link in the chat or just scan the QR code. And lastly, you can always join our traditional masterclass series with Black Fox, which are going to resume in September and in October. With that being said, we are really thankful to have you all here, and thank you once again to the speakers and everybody that supports and joins every session. So thank you again, and we hope we are going to see you soon in our upcoming series. So as always, we do say goodbye in our own languages, so feel free to do so. So goodbye and real papshim from me.